Hi, it's Patrick from intensivecarehotline.com with another episode of Your Questions Answered. This week, Moira from Brisbane in Australia writes in, and Moira says, "Hi Patrick, my 53-year-old sister has been admitted to intensive care in the last fortnight with a severe stroke and she hasn't been well at all. She went through several procedures including ventilation, had CTs of her brain and she had lines inserted. It looks like now she has developed pneumonia, probably from vomiting earlier in the week. Worst of all, she hasn't been waking up appropriately for a while, despite the doctors trying to get her out of the induced coma. Because she hasn't been waking up, the question of who is her next of kin has been raised, as somebody needs to sign for consent for treatment and procedures as long as she is unconscious. What makes matters worse is that my family can't agree on what might be in her best interest, and several people want to be her next of kin. My sister has been divorced and has 2 children from a previous marriage who want to be her next of kin. Her current partner is living with her, but they're not married and he also claims kinship. My sister's children say that her partner doesn't know her well enough to act in her best interest, whereas her partner claims that her children don't see their mother often enough to be her next of kin. We have spoken to the social worker in the ICU, but again there was no resolve of the issue, as the children and my sister's partner couldn't agree and all they do is argue even in front of the social worker. I have tried to stay out of the argument and if anything I try to be a mediator trying to find a solution. It has also come to the point now where my sister's children are avoiding her partner and vice versa. It's a dreadful situation and it doesn't serve my sister. Can you share any advice of what to do in such a situation, as we can't agree and the situation is likely getting worse and would definitely not be in my sister's best interest if we can't agree?" Hi Moira, great question. The situation you have described is quite a common one in intensive care that can create massive issues if not resolved quickly. You have clearly identified that the inability to agree on your sister's next of kin is causing her harm and is not in her best interest. It also sounds like your sister's partner and her children can't agree on the right course of action and they can't agree on what might be in your sister's best interest. You have also realized that this situation can't go on and it needs resolve quickly. First of all, realize that if your family doesn't come to a conclusion about kinship for your sister, that other people are running the show, meaning the intensive care team will make decisions regarding your sister's treatment with little or no input from your family. That in and of itself should be enough motivation for your sister's children and her partner to come together and find a solution to the problem. Also, something that I have seen over the many years in intensive care is that families who are clear in what they want for their critically ill loved one have a much higher degree of control, power and influence during the time their loved one is critically ill in intensive care. Those families usually also agree to have one spokesperson during the time of their loved one's stay in intensive care. On the other hand, families who don't agree on a spokesperson or a next of kin during this time of crisis will have a difficult time to manage not only the family dynamics, but also to manage the dynamics in intensive care and their level of control, power, bargaining power, and their level of influence diminishes in spades. Furthermore, the situation of having a loved one critically ill in intensive care is challenging and frustrating altogether, and having to deal with difficult family dynamics only adds up to your and your family's frustrating situation. Worst of all, it doesn't serve your sister, who can feel all of those negative vibes around her. Some action steps for you to consider are: get your family together and stress the point that you need to find resolve quickly, and that it's not about the partners or the children's egos and about their mother's or partner's best interest. Secondly, having difficult family dynamics is nothing to be ashamed of. Many families have it, and you need to put them aside during this difficult period in your sister's best interest. Number 3, stress the fact that you think that not coming to an agreement will only leave your sister even more vulnerable, and your family will have little or no influence in decision making. It also leaves you and your family vulnerable in an already difficult situation, as you are not united in this difficult situation. Number 5. Talk through the best and the worst case scenario and find out what all parties involved think would be the best course of actions. Number 6. Make clear to your nieces and your nephews and to your sister's partner that you can only have control, power and influence in this challenging situation if you put your family dynamics and family issues aside. Number 7. It also sounds to me that some family members might have difficulties facing the reality and the ordeal your sister is going through, and they are putting up barriers by focusing on other issues that are less important. And last but not least, once they have accepted the reality they are dealing with, it would be easier on agreeing on the right course of action. I have also created a free report about 5 things family do who are in control, have power and have influence in the situation when their loved one is critically ill in intensive care. Send me an email to support@intensivecarehotline.com and I'll send you the free report. You can also send another question if you want to ask another question. Send another email to support@intensivecarehotline.com, and you can also sign up to our free membership with your email down below, and you get your free instant impact report so that you can learn instantly what you need to do in order to take control of the situation. You'll also get 4 more free reports, such as 6 questions you need to ask the most senior doctor in intensive care, the 7 answers to the 7 most frequently asked questions whilst your loved one is critically ill in intensive care, 10 things you didn't know doctors and nurses are talking about while your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for watching this week, and it's Patrick Hutzel here from intensivecarehotline.com, and I'll see you again next week in another episode of our Your Questions Answered episode. Thank you.